thank you for joining this webinar, which is taking part as part of the King's Wellbeing Festival. It's a real great opportunity to welcome everybody here and thank you. Just a few housekeeping things before we get going, but also to introduce myself. So I'm Irene Higginson. I'm a clinical academic. That means I'm a doctor and a researcher. And I also lead the Better Health and Care Hub, and I'll be sort of facilitating this morning. But everybody's very welcome, and it's great to have everybody here. If I could ask you please to turn your microphones off during the talks. Please feel free to use the chat function throughout to submit questions or comments. We probably will deal with all the questions at the end. And just to remind everybody that we are recording this event. So please, if you please be aware of that. And that's so that people who can't make it now will be able to see it at another time. If you do post on socials, please be sure to follow us and tag us, and we'll put in the chat the X, Blue Sky and LinkedIn socials that we have so that you can see them there. And if you would like to find out more about the Better Health and Care Hub, then we'll also put a link to that in the chat for you. And I think those links will be coming soon. But everybody's very welcome. It's fantastic that you're here. So if I could move to the next slide, please. So we're talking about what research has taught us about how to manage breathlessness. And just to reintroduce myself, I'm a clinical academic. So I'm a doctor and a researcher and teacher. And I'm also director of the Better Health and Care Hub, which is a King's-wide activity and so on. So if I could go to the next slide, thank you. So let's talk about breathlessness and why breathlessness. What is it? Well, it's the feeling of not getting enough air. And actually, it's one of the most common and devastating symptoms in many chronic illnesses, such as lung conditions, heart conditions, some infections, some neurological conditions, and more. There is an internationally agreed definition, which is that it's the subjective experience, i.e. it's what the person who's experiencing the breathlessness says it is, with multiple physiologic, psychological, social and environmental factors. So lots of things influence breathlessness. Now, we all experience breathlessness day to day if we're running for the bus or doing something that's active. Well, I certainly get it when I run for the bus. And when it becomes severe, it's quite frightening for the people experiencing. Normally, when we run for the bus, if somebody's normal, they recover quite quickly. But for people who've got a lung or other condition and they don't recover quickly, it becomes very frightening for them and their families. And it's very common. More than 2 million people experience breathlessness in chronic illness in the UK. And in our research, our interest was that breathlessness was very neglected, particularly the breathlessness that continues despite the best possible treatment of the underlying condition. If I could go to the next slide. But breathlessness is also a normal part of life that makes it slightly different. If you could just click on one as well. For example, it's used in as a positive in movies. So this film with Madonna called Breathless is about the excitement that people feel when they get breathless. And I'd like you all to reflect. You don't have to put this in the chat. But what were you doing last time you became breathless or out of breath? If I could go to the next slide. What people say, and if we could just do 4 clicks, I think, people often say that breathlessness engenders these types of feelings. So it's dreadful, suffocating, the worst thing ever, struggle to catch a breath. And if we could go to the next slide, here's some what people said in our research. Somebody goes to the doctors, walks in, it's a sunny day, but the doctor says, oh yes, you're very well, and off I went. But as soon as I got to the bus stop, by the time I was there, I was out of breath and exhausting, and I remember why I was feeling depressed and so on. So it's often a very common symptom, but it often ends up being invisible. So our first research that we've done was to try and understand what people felt about breathlessness, what caused it, and how we knew how to manage it. So on this slide, it just tells you a little bit about breathlessness and how it happens before we go on to talk about how to manage it, because in many ways, if you understand how breathlessness happens, you can think of ways to manage it. So breathlessness really happens because the brain that we have compares how much oxygen the body needs with how much it's getting. And if there's a mismatch, particularly if the brain says, I'm not getting enough oxygen and I need more, because the body needs more, then it creates that feeling of breathlessness. And this might happen because the lungs or heart are not working as well as they should. So either the lungs aren't being able to get oxygen from the air into the blood, or the heart can't pump it around the body as well as it should. So then the body needs more oxygen. But it can happen for other reasons too. And these other reasons are very important in thinking about how to manage breathlessness, because breathlessness can happen if the muscles are not very strong. Because actually physiology tells us that if muscles are strong, they actually work more efficiently. They need less oxygen. So if the muscles need less oxygen, it means if the lungs don't work quite so well, but if the muscles are strong, then they'll do better. And a common example I give about this is if I run for the bus, I get out of breath. But if an athlete runs for the bus, they don't get out of breath. And the difference is not in our lungs, but in our muscles. So you can also get out of breath when you make muscles work hard, such as in the gym or if you're carrying a heavy load. Although when you do this, people generally recover quite quickly. And of course, we go to the gym to make our muscles stronger, or we carry things to make our muscles stronger, so that they will then be more efficient. In addition, anxiety or panic can make breathlessness feel worse, even if the physical problem has not changed. And there often comes, for people who are ill with breathlessness, a vicious cycle of doing less and getting more breathlessness. And you can see that on the figure on the left-hand side, where somebody gets breathless, they do less, the muscles get deconditioned, they get weaker, they get leg fatigue, leg weakness, so they do less, so the muscles get more deconditioned. Then these muscles don't work so well in taking oxygen from the blood and clearing lactate and CO2 production, and so you get more breathlessness. So our research aimed to try and unravel that and understand breathlessness. And my colleagues in a minute will give you some specific examples that you can use, but just to summarize some of the things that we've learned over the years from research at King's on breathlessness. As I mentioned, our early study looked at the impact, how to measure breathlessness, what the potential treatments are, and how it evolved over time. And one of the biggest things we did was to challenge the pessimism that existed around breathlessness. Oh, there's nothing we can do, nothing anybody can do. People and patients would say, I feel worthless because I'm breathless. And if you can tackle that, you can make people have, as a patient said to me, a new perspective on themselves or their lives. There was a lack of assessment and consideration even of breathlessness. So one of our key goals was to stop breathlessness being so invisible. We also developed novel, frugal, drug-free treatments, because actually there's quite a lot, and we're going to show you those, of drug-free things you can do to manage breathlessness. And we put these together into a breathlessness support services, and we'll give you a link to all the toolkits that we had for that in the chat. And we did studies to show that these were effective in randomized trials, and then we did further analyses. And interestingly, for people with chronic respiratory diseases, so lung diseases like chronic obstructive pulmonary disease, these improved the quality of life that they had, and for some people even it improved their length of life. We did work to bring together, other international studies started to take on this work, and then we brought it all together into a meta-analysis that confirmed this finding. And what we're doing right now is turning this into a web-based self-management so that actually people can access this better. We've also researched different drug treatments, done reviews of those, and recently completed an international randomized trial of one of the drugs, although sadly it didn't help breathlessness. So the best treatments we've got are the non-drug treatments. And we've also done a lot of work producing guidance, practice, use, etc., etc. So that tells you a little bit about what we've done. Take a look at the link. But I'm now delighted to hand over to Dr. Joanne Bailey, Jo Bailey, who's going to talk about practical strategies that you can use to manage breathlessness. Jo is a very talented research associate. She's leading a major European trial for us, looking at some of these techniques in practice for people who need them in early treatment. And she's a research associate in the Florence Nightingale Faculty of Nursing, Midwifery and Palliative Care here at King's. So, Jo, over to you.
Thanks, Irene. Then today I'm going to just talk about three main areas that we focus on. I'm a physiotherapist by background and worked clinically for many years before I came to CSI, using these techniques in my practice, and now delighted to be part of research studies testing and evaluating them. I'm going to look at the three areas of recovering, getting your breath back, planning and preparing to avoid episodes of breathlessness, and then things that we can do to prevent episodes of breathlessness occurring. And hopefully these will be useful for yourself, your friends, families, or if you know anybody in your family who is experiencing breathlessness, maybe you can take something away today, or at least have more information about what to ask your healthcare team for. So if we can progress to the next slide. The first thing to think about when we're wanting to get our breath back is to recognise that we're actually becoming breathless. And people with busy lives can often persist in an activity when they're becoming breathless to the point where their breathlessness becomes really difficult to recover. So one of the first things we teach people who are experiencing breathlessness that is uncomfortable and difficult for them is to recognise when they're starting to get breathless. And some of the early signs that you're struggling to get your breath back are when you can't take a breath out properly, or you can't finish a sentence when you're talking. If you're walking somewhere with somebody and they can't finish a sentence, they're taking breaths in the middle of the sentence, then that's an opportunity to recognise that breathlessness is coming on, and that you might want to slow down the pace of walking if you're walking with somebody, or encourage them to pause or even have a rest. So recognition of breathlessness and recognition of your own breathlessness is the key first strategy to getting your breath back. Another important strategy that people have found very useful, all the people I've worked with over the years, is to have a recovery place, somewhere that's you sit to get your breath back, that puts your body in a good position to get your breath back and helps you to feel comfortable and, most importantly, safe. And on the slide here, you'll see that there's a chap sitting at a table, and leaning forwards on a table with your elbows supported takes the weights of your arms and your upper body and reduces the work of being in sitting so that it's easy for you to get your breath back quickly. You'll notice there he's got a glass of water, something to distract him, and a fan, although not a handheld fan. And we know that handheld fans are really important, and the picture underneath you can see the lady there is holding it in a good manner. She's holding it so the air is directed towards the skin around her mouth and the bottom of her nose, because there are nerve endings in your face that, when stimulated, help to reduce the sensation of breathing and help to slow the respiratory rate down. So being in a really comfortable position with a handheld fan, something to distract you, something to drink, feeling safe. The lady in the other picture is sitting in a really good chair. She's got her arms supported, her feet are flat on the floor. The chair looks deep enough for her to sit comfortably. And more importantly, it looks like it's going to be easy for her to get out of. And this may be her safe space. Breathing techniques are also really useful in helping people to get their breath back. And the techniques I'm going to show you today are some general ones, but importantly, the breathing techniques might vary depending on your health condition. So it is important with breathing techniques, if you do have a respiratory condition, to talk to your healthcare team about the best breathing techniques for you. But in general, when we're breathless, the most important thing to think about is getting your breath out, emptying your lungs, so that the next breath in can fill your lungs with air and with oxygen and can get rid of all the carbon dioxide in your lungs. So we normally encourage people, rather than thinking about taking deep breaths, which make people put lots of effort in and try to pack air into lungs that are already full, we encourage people to breathe out slowly. It doesn't matter whether it's out through their nose or their mouth, whatever is comfortable and most natural for them, but breathing out slowly through the mouth. And if you're with somebody who's breathless, that's something you can say to them. Breathe out slowly, and you can even mirror it. You can breathe out slowly yourself to encourage them to feel safe and breathe out slowly. Pursed lip breathing can be very useful, and you might want to try that now, especially if your microphones are off, but where you just gently purse your lips and breathe out through the pursed lips like this. It slows the breath down a little bit, but more importantly, it creates a little bit of back pressure into your lungs, and it helps to stop all the small airways from collapsing, so that when you next breathe in, the airways are already open and it's more easy to fill your lungs. And pursed lip breathing can be used in combination with diaphragm breathing. And wherever you're sat now, you might want to put one hand on your tummy, just below your belly button, and another hand on your chest. And just as you breathe in, just see if you can feel your tummy just gently rise as you breathe in and fall as you breathe out. For some people, diaphragmatic breathing is the way that they normally breathe, and it can come quite natural to them. For others, they breathe with their upper chest naturally, and it can be quite hard to learn diaphragmatic breathing. And if it is difficult for you to learn, it's probably not the best thing to try when you're trying to recover your breath. It's something to learn between episodes of breathlessness and to practice, so that next time you're breathless, you can comfortably and confidently use your diaphragm to recover your breathing. Diaphragmatic breathing is worth practicing, because when you breathe with your diaphragm, again, it sends messages to your brain which are associated with calming and will help you to recover your breath back more quickly. Many people have learned breathing techniques that are associated with meditation or religious practices. And if that's the case, then these techniques can be used very effectively to help you to get your breath back. And you should use those and strengthen your ability to use those to recover your breathlessness if they're helpful. Self-talk's vitally important. Many people don't really understand how their lungs work and are afraid when they're breathlessness that something really bad might happen to them. And some people might even think that they might drop dead during an attack of breathlessness. And being able to explore and understand your condition and the causes of your own breathlessness and what can be done to relieve it can help you to create little self-talk phrases that will help you to recover your breathlessness. Self-talk's also useful because focusing on your physical body, on your diaphragm for more than a short period of time can actually make you feel too aware of your breathing and can make you more breathless again. Self-talk, something like a nursery rhyme. Lots of my patients used to use a nursery rhyme like Mary Had a Little Lamb, and they'd say the phrases on the breath out. Or rosary beads. I lived in Liverpool for a long time, and many of my Catholic patients would sit with their rosary beads and go through a bead on each out breath. But finding something to self-talk and help you to pace your breathing can be very useful. Most importantly, family support. What can they do to help? Can your family help you to find your fan, help you into the comfortable position, help you with comforting, calm statements to help you to recover your breath back, remind you of what you can do, and remind you that you can get your breath back and that this will pass. Can we go to the next slide, please? And just a little bit more about positions of ease. Now, this picture on the left of a lady with a V pillow on her knees, I wouldn't necessarily encourage somebody who's breathless to sit in that squatted position, but a V pillow can be very useful if the chairs you have at home don't have good support for your arms. Again, when somebody's breathless, we want to take the weight of the arms and provide support for the upper body to help the person recover their breath. And often V-shaped pillows are used behind somebody's body, which can be useful if someone's got back pain. But when you're breathless, it can be nice to just to bring it round onto your lap to give your arms somewhere to be supported. The other thing to think about when you're positioning yourself is to not be slumped in a slumped position. If you want to try it now where you're sat at home, just try breathing in, try slump down into the chair as much as you can and try and take a deep breath in. And when you've done that, then sit yourself up so that your belly button comes forward. You put a gentle arch in your lower back. And in that position, you put your diaphragm in a better position to take a good breath. And when in that new position, try taking a deep breath there and feel the difference in your chest in that new position. The leaflets on this slide can be obtained from the link in the website there. And it's good to practice these positions if you are breathless, and adjust them slightly so that they work for you. And think, am I able to take an easier breath in this position? And then remember those positions. Tell your family about those positions, and then they can help you to get into those positions when you're next having an episode of breathlessness. Can we progress on? It's really useful if you're somebody who does experience breathlessness to think about how planning and preparation and pacing can relieve your breathlessness. And again, you might need to get your family involved in helping you with this so that they don't pepper your diary with lots of strenuous activities, all one after another. It's useful to pace out activities with strenuous activities with lighter activities and periods of rest. Plan in advance. Am I going to have an opportunity to sit down if I need to? Is my recovery place in this place prepared? Have I got my handheld fan with me, and does it have fresh batteries? And often people will find it useful to have handheld fans in multiple places around the home, upstairs, downstairs, in the bag you go out to the shops with, in the car. Your main carer also has a backup fan. If the fans are useful for you, then have plenty of them. They're quite inexpensive to buy. Stairs is a really good example of where pacing can be useful, and we've actually got evidence that if you pace your breathing when going up the stairs so that you make sure that you take a good breath in and out on each step, that it doesn't take you any longer to get up the stairs by the time you factor in recovery time. For people who are extremely breathless, they might find it helpful to put both feet on one step and rest on each step. There's actual evidence that pacing as well. Sorry, that's the wrong thing. I'm moving on to traffic lights, which I'm going to say on the next slide. Another thing with pacing, planning and preparation, again, is to get family to think about how they can help you. I like on this slide that this lady is continuing to participate in activities, but she's using a stool so that she can prepare a meal more effectively. She might from the stool be able to stand up and walk around the kitchen for other cooking activities, but having the stool there means that she can sit down and have a rest and still participate in her family life. Can we move to the next slide, please? This brings back the slide that Irene's just shared about prevention and how important it is to break into this cycle of deconditioning where muscles don't work as efficiently. But we can also have a vicious cycle of fear where if we don't understand our breathlessness and if we're not confident about how we can manage our breathlessness, that can also become another vicious cycle. We can move on to the next slide. And with physical activities, lots of people I know are put off by the word exercise and don't feel they can participate in exercise. And if you can participate in exercise and get your muscles strong, that is great. But if you can start off by just sitting less, spending less time sitting, doing more physical activities, getting out with friends, that will also help you and benefit you. And then maybe in time you'll feel that you have the confidence to participate in an exercise program. And with exercise, it's important to find an exercise program that you feel safe doing and that gives you pleasure, as well as helping you to get your muscles stronger and help you to relieve your breathlessness. And then the final slide, I think, is next to final, walking aids. Oh my goodness, the number of people over the years who have resisted getting a walking aid from me when I've tried to encourage them to use one. Walking aids are a very, very effective way of relieving breathlessness, even if you're not unsteady. And the evidence I was going to tell you before is about traffic lights and pedestrian crossings. And many pedestrian crossings in the UK don't give you very much time to get across the road. And we know that many people who are breathless go out less, so they're reducing their physical activity because they're afraid of getting across the pedestrian crossing in time. Using a walking aid can help you to get across the pedestrian crossing in time because it reduces your breathlessness, and many of them have a seat. So when you get to the side, you have a seat that you can take with you so that you can rest whenever you want, and that enables you to carry on with activities that are valuable to you. And then the final slide. Don't struggle. Many people think that being breathlessness is just a sign of aging, or it's a part of their condition that's irreversible. It's not. As Irene said, there's much evidence that shows that the strategies I've shared with you today and others are really effective at helping you to manage your breathlessness and live your life more comfortably. And these on this slide are some of the examples of things that your healthcare team can refer you to support you with your breathlessness. And there's some links in the chat here for people who are experiencing serious breathlessness towards end of life. The team over at St. Christopher's have put together some fantastic videos. To be honest, they're such good videos. I'd watch them even if you don't think that you have really serious illness, that they get across all the key points from the evidence in a very compelling way. So thank you for your time, and good luck managing your breathlessness.
Thank you very much, Jo. And I hope everybody's now sitting up straight and have practiced breathing out as well, which is one of the very important tips that people often forget, because they breathe in and in and in when they're breathless. And in fact, breathing out is one of the useful things that you can do. Now, one of the things that we've had to face very much in recent times is the issue of COVID, and in particular long COVID. And breathlessness is one thing that people with long COVID often experience. So I'm delighted now to welcome Monica, who is a professor of applied health care and health and care research here at King's, and also is a vice dean of people in culture in the faculty of nursing, midwifery and palliative care. And she's going to talk about some of the work that they've been doing on personalized self-management support for breathlessness. So Monica, welcome and thank you. And then after that, we'll have a little bit of time for questions and discussion. If you want to know why or how some of these things work or go over anything again, we can do that. But Monica, over to you. Thanks.
Thank you very much, Irene. So yes, I'm going to tell you a little bit about the LISTEN trial, which was funded by NIHR in their call for addressing long COVID in non-hospitalized individuals back in 2021. And I'm just going to start with a little bit of a short clip, really about sharing what people might be feeling and what led us to developing this intervention and running this evaluation. So is going to come.
Listen, a new way forward.
Monica, I'm not sure the sound's working on this video.
No? Oh,
No.
okay.
I wonder if you could send me the link at some point. I can put it in the chat after your presentation, maybe, and people can watch it in their own time.
I'll do that. Okay. Sorry about
Thank
that.
you. Sorry.
The sound is working beautifully for me, so I was really liking it, and no one said anything. Okay, I'll put that in. We'll put that in the chat as soon as I've finished with this presentation. So essentially,
Thanks,
Monica. I'll move on then. No. Oh, come on. There you go. Right. So what we did. So this was a grant that was funded in July 2021, and it came out of our. This was led by myself and Professor Fiona Jones, both of us physios, both of us observing people being very ill with COVID, and both of us saying, oh, what's going to happen when people recover? And so that was the background for this. But what we wanted to do was really understand, because we didn't have any evidence necessarily for, new condition, long COVID, and we wanted to co-design and evaluate a personalized self-management support intervention for people who were living with long COVID, recognizing that this was for people who were not hospitalized for their COVID illness, because there were a lot of people who were in the community who were living in the community, but actually then developed longer term symptoms. So what we really wanted to do was reframe this idea about personalized self-management support in the context of understanding that long COVID symptoms were complex and variable. And we did that by following an accelerated co-design process where we placed the narratives, the stories, the experiences and the concerns of people living with these longer term symptoms central to the intervention. because in the absence of a treatment, we really needed to rely on the collective experiences and the expert knowledge of those people who had navigated that process. So once we had co-designed this intervention, we then went on to evaluate the effectiveness and the cost effectiveness in a randomized controlled trial in 554 people. So the premise of the intervention was one-to-one conversations with trained practitioners, but also bringing people's knowledge and experience to that intervention. And so we called it a community in the hand. We developed a book that could be sent out to everybody who received the intervention that was also part of the conversations that they had with those trained practitioners. And the book had 6 sections. It was really talking about people's experiences, their journey, their symptoms, their challenges, how they managed the journey. And it also encouraged people to reflect and plan. And there was a really useful part of the book, which was reflecting on what we wish we'd known. Now we've come through this pathway. So just in terms of the breathlessness part of living with long COVID, this is just one extract from the book that I took where we spoke to people about their challenges. And this is a quote from Rob, who said, breathlessness is the most serious symptoms because it's worrying. And I used to get really breathless at the slightest thing, and I'd get out of breath walking downstairs. So his solution, breathing through the nose. So this is where Joe has already talked through some of those solutions. And he was saying the trick is, if you're breathless or you've done something that's made you breathless, you've got to manage somehow to convert that back to breathing through your nose, and then it'll settle down. It might take 2 or 10 minutes, but the more you do it, the better you get at it. So in the handbook that we had, we also shared tips and guides around how people could actually think about how they could manage their breathing. But the handbook also covered more, because the symptoms of long COVID, there are over 200 different symptoms reported. So that's one of the challenges that was for us. But just in terms of breathlessness, all of the techniques that Joe has already shared are techniques that are useful in managing the breathlessness that is associated with long COVID. So what did we find in the trial? Well, we had a whole range of outcome measures, but I've just pulled out the one around control of symptoms, where people who received that listen intervention had greater feelings of symptom control as measured by the generalized self-efficacy scale. So higher scores are better. And we found that when we accounted for your baseline, the baseline levels of age, and also age, gender, and ethnicity, as well as the number of long COVID symptoms, that people in that group, that intervention group, had on average scored 3 points higher than those who didn't receive that intervention. And the quote there, I suppose one of the big changes, and I think this is where the intervention from the Listen study has contributed, is that feeling like I've got some sort of control over what those symptoms are. So what are we doing now? Well, we found that the Listen intervention was less costly and more effective than NHS usual care. But what we know and what we've learned is that, long COVID has brought great attention to the longer term, the tail that is associated with post-infection conditions. And we know that people following an infection may experience episodic multiple symptoms that are very challenging. But we also know that they disproportionately affect people with multimorbidity and higher social deprivation, and also different ethnic groups. And that's really central to the Better Health and Care Hub's mission around tackling inequity and complex conditions. So we now have support from the Better Health and Care Hub through accelerator funding, where we're working to take this Listen self-management support model to primary care settings. And we're starting to work to better understand how health and care for post-infection conditions more broadly is experienced by people in primary care, and try to work out what we need to do to really reach those marginalized communities, so that we can then take this kind of model forward more broadly. So that's what we're doing with Listen. So I'm going to hand back over to Irene now, and I'm going to find the link for the video for you.
Monica, thank you so much, and thank you also to Joe before. So what we're really keen now is for, if you're willing, to turn on your cameras, if your connection allows you to do that, and allow and turn on your microphones if you wish to raise your hand and ask a question, or pop a question in the chat. We have a little bit of time left now for questions and discussions. We're a nice small size group, so you're all very welcome to ask questions if you're comfortable with that. Just to give you a little bit of more information, Joe reminded me very well of the importance of breathing out. And in the breathlessness support service, on the web link that we gave you, it's the first web link, you'll see links to information that we gave to patients and families, and there's also an e-learning module for health professionals, but to access that you need to be behind the King's College, the King's Health Partners firewall. But I'll give you in the chat the link to one of those, which people called the breathlessness poem, which was all about practicing dropping your shoulders and breathing out. So I'll pop that link in the chat as well, because I think it emphasizes what Joe said. And just if you're wondering, why does a handheld fan work? Well, that's really interesting. But the reason why it works is because this part of the face, the nerves, connect with the breathing part of the brain. So if you cool this part of the face, it actually reduces the sensation of breathlessness. So there's quite a lot of science behind many of these different techniques, even though they seem quite simple. So over to you, or questions. Otherwise, Joe and Monica are physios, so they can get us all up, moving about and practicing our breathing, if people would like to try that as well. Zoe, how lovely to see you, and over to you.
Thank you. Thank you for this session. It's very useful. I was wondering, I don't know if you knew at all if things that sort of gentle exercise, things like Tai Chi, were helpful for managing breathlessness. We've got a bit, my father suffers from it, but he's a big Tai Chi fan. So I'm trying to think of ways to gently encourage him without him telling me off for over worrying, but maybe encourage him to do things that he's already doing.
Well, it's a wonderful question, Zoe, and the answer is yes. There's even a randomized trial in it. I'm very interested in it myself, and I wouldn't mind trying to do something like that in the UK. And we had an MSc student as well who did a trial. I don't know, Joe, if you were involved in her work, and she did a pilot study of it. So the first thing to say is that there are various different types of Tai Chi, and there are different types that do or don't build your muscle more. So the very simple type that's very commonly done probably doesn't build muscles quite so much. But Wu Tai Chi, and I'll have to remember the name, but there's another one that involves even more work. It involves strengthening muscles as well. So Wu Tai Chi is the type that does single weightedness. So you practice standing on one leg. It's actually very good for a number of health benefits, including balance as well. And that strengthens the leg muscles. And there's another type of Tai Chi, which for an older person might be a bit too much. So it is about doing Tai Chi, but also doing the types that do strengthen muscles as well. Tai Chi also is quite good because it helps you relax different parts of the body, relaxes you, and you know, some of the things, I will confess, I do it myself. So so it has a number of values, Zoe. So I would say continue. But Joe, I don't know if you've got anything to add. As Joe said, do things that people enjoy and build on that. So people like dancing, go dancing. Joe, do you want to come in on that?
No, I agree with everything you've just said. I think the strengthening element's really important. So if your dad preferred the type of Tai Chi that didn't strengthen his muscles, then maybe he wants to get some home exercises that are muscle strengthening that he can do in addition. I think one of the lovely things about strengthening exercises is that you only need to do them 2 to 3 times a week to get a benefit, unlike aerobic exercises where you need to exercise more frequently. So I think very definitely encourage him to start Tai Chi. And I think one of the things that beginning with any physical activity that you enjoy, it starts to increase your confidence in your own body again. I think people with breathlessness become afraid of their bodies, and anything we can do to help people to feel more confident and less afraid of their breathlessness in their bodies will then take them on that step to being able to do more productive strengthening exercises maybe a little bit later. The worst thing is sedentary. Being still all the time, not only are you not exercising, but being sedentary is actually harmful in itself. So that's a message for all of us, including myself. When you're a researcher and you can get stuck to a computer, but get anything that gets you up. But yes, I would encourage him to do his Tai Chi.
There's a really good... Oh, Zoe, come back to us.
No, I was just going to say thank you. I think, yeah, to have this kind of advice is absolutely magic. So thank you very much.
I mean, a lot of us are involved in supporting people for all sorts of reasons who get breathless and do less and less because of it. And that has multiple health challenges. So in some ways, addressing the breathlessness can help other health feelings as well. Joe and Monica, there's a really important question in the chat from Andrew Webb. I don't know, Andrew, if you want to speak, but Joe, maybe you could have a read of that and see what you think from a pneumothorax and any particular things. I think probably, yeah.
Yeah, I think if somebody's had a serious respiratory event like a pneumothorax, I would initially go back to what advice was he given by the healthcare team that were looking at him at the time. But then it may be that to increase his confidence in using breathing techniques and exercise, he might be somebody who would really benefit from referral back to for an outpatient respiratory physio appointment. So he could be assessed and his current health status can be assessed and he can be given breathing techniques and strategies that are tailored to him. I think one of the things I most realized as a clinician is even though you think you the techniques appear simple, they're so variable in how you put them together for individuals, and they're most effective when you tailor them to the person in front of you and how they want to live and what's important to them in their daily life. So I would encourage your dad to either see a respiratory physio or a community physio who has access to his health records and can give him a tailored plan. I don't know if Monica has anything to add to that.
I don't have anything. I just was thinking back to when I was training in South Africa, and when we had a lot of people with acute pneumothoraxes come in overnight, and the main thing we did was get people moving. And we used to say, come on, let's go up and down the stairs. So that's what we used to actually do as physios way back then, was about moving to get breath into the lungs. So I don't have anything else to add to what you said, but just what we did in Africa a long time ago.
The other thing I would emphasize is the real importance of pacing. I think we underestimated. There are randomized trials that show that if people pace themselves, they can walk further. And as Joe said, if people pace themselves, they can actually get up the stairs as quickly as people who don't pace themselves. So pacing yourself is really important. That means not going to the point where you get really out of breath and it becomes uncontrollable, but stopping before then and planning. So planning, I'm going to go from here to there because I know I can do that, and I'm going to have a rest at that point. That reduces all of the anxiety associated with it. But actually people build more and go further and get more confident. All the research seems to indicate that if they pace and plan. And these are really simple things that people can do, but it's amazing how many people in the healthcare field don't really know about it. So one of our missions is to try and make everybody know a bit more about these simple things that people can do. Any other questions or thoughts? Please feel free.
Yeah, there's another question in the chat from Prashi. I hope I've pronounced your name correctly. I think this is a really important question, because I think anxiety, depression, stress and life challenges have a real impact on people's abilities to take care of themselves. And it's all very well for me as a physio to say to somebody, try and get out every day, try and have some physical activity. But if you don't feel safe in your community, or if there's very high levels of pollution in your community, and you're lonely and you haven't got anybody to walk with, and that really does challenge any physical activity advice. And we can be very didactic and simplistic when we don't consider people's life circumstances when we're giving breathlessness advice. So I think in these situations we need to think more broadly, and we might need to think of other strategies that can support the anxiety and depression and stress and the life challenges as really important stepping stones and scaffolds to help the person be in a situation where they can start to use more direct strategies for their breathlessness. And I don't know the situation of the person you're thinking about, but certainly when I was working in the hospice, the multi-professional team that we had in the hospice, we had the kind of range of support available to help people with sometimes really challenging and intractable situations. And often once people knew that we were helping them and alongside them with those other issues, then it was more easy to help them with their breathlessness as well. But I think you're absolutely right, and we can't underestimate those other compounding issues.
Thank you, Jo.
Can I just sorry, there's just one other thing though to that. But
yeah.
I think again, sometimes simple breathing exercises at home can actually have an impact on some of those symptoms. There's another breathing technique which we often use with patients called breath stacking, for people who don't feel like they're getting a good breath, or for people who are depressed and not very active. And it's where you just take a very small breath in and then you don't breathe out, just hold your breath for a partial second, and then another little breath in, and then another little breath in, and it kind of gives you that feeling that your lungs are expanding, and that sensation of your chest expanding can be very uplifting and calming. So again, this is where tailoring works, where we can practice different techniques which may also have a kind of side benefit on anxiety and depression.
There's two other things I would add. One is that because I think that breathlessness itself causes anxiety and makes the world feel worse. And then if people are anxious and worried about things, that then makes the breathlessness work. So we provided in the pack, in the breathlessness support service, distraction techniques, which are ways in which you can do that. We also had a kind of mindfulness video that people could listen to, audio recording that people could listen to. And the other important thing to remember is that sleep is actually a lot more important than people think about. And if you don't get a good night's sleep, then actually that will make the breathlessness worse. And of course, if you're worrying, then you don't get a good night's sleep. So we developed a good sleep hygiene sheet, which I'll post the link in the chat. All of the links come from the toolkit that we gave people who had breathlessness, and they could use different ones. So it might also be that that would be helpful as well. So I'll post that in the chat. Prasha, if you've got anything else you want to come back on or ask, do please say. And then I think we've got a question about long COVID. Monica, come in and you can probably do that question as well. Thanks.
Yeah, I was reading that one. So, and you're absolutely right in that it does become a vicious cycle. Hazmat has said this about, you want to preserve your energy. And the key thing that we learned in the Listen trial was around the pacing and identifying when in your life, in your kind of 24-hour period or in the week, you can do those activities, but also then adjusting expectations and not assuming or not judging yourself simply because you're not able to do what you used to do. It's about finding a new way of being active and different things to be able to get that activity, but in a way that doesn't put that pressure on yourself that then you end up being exhausted afterwards. So that was the key thing. It's about identifying at what point do you need to stop and rest. And that's where the pacing comes in.
I think as well, finding meaningful activities. Generally, when we're doing something that has meaning for us and that we enjoy, we feel better. And it's an opportunity, I think, to try new things. And this is where, again, family support is really, really helpful to facilitate those new activities.
There's a wonderful question in the chat as well from Valerie about whether menopause and hormonal changes can affect or cause breathlessness. Yes, I'm sure that they can, directly and indirectly. So indirectly, you know, if people are having menopausal symptoms that are causing particularly night sweats, then that's affecting the sleep, which will make breathlessness worse, and it will affect things. I would imagine that the hormonal changes will also affect, and in fact they do affect muscle metabolism, so making the building of new muscles, etc., slightly more tricky. Probably quite important to make sure that you're getting good vitamin D and calcium during that time. But I don't know, Monica or Joe, if you've got any particular reflections on that, or if anything came up in the long COVID work.
I would have to go back and look up. Nothing specifically came out in the long COVID work around that. And I think it's because there just haven't been big enough studies.
Yeah.
So I think it's very hard to make recommendations based on that because it's such a new condition and we honestly don't know. But
Yeah.
so what really for us, it was about taking the lived experience and the expertise of people who had found success in different ways.
But I would say from a kind of specific hormonal point of view, we do know that lower levels of estrogen and progesterone that you would get in menopause or in some other situations actually do reduce the elasticity of various parts of connective tissue, and that can include the lung connective tissue, so that can make them a little bit worse, and it can also the estrogen changes can also affect the inflammatory system, which can also give you an inflammatory feeling, which is like what you get post-infection, which can also cause those problems. So I think that it is, from my understanding, it is quite common actually for people who are experiencing the menopause or the hormonal changes to experience some respiratory symptoms. And I think that if that happens, then actually getting some help on that, and also thinking about what Joe said earlier about getting an assessment and a plan to actually kind of counteract these to avoid the sort of cycle of deterioration that we described is actually quite important. But using pacing and using planning in the meantime is probably good. I don't know, Joe, if you've got any other individual sort of advice for that.
No, I think our learning on menopause and health conditions is getting better every year, isn't it? It's certainly something that we weren't taught about it many years ago when I was at physio school. But I think that the impact of menopause on the musculoskeletal system and our ability to maintain fitness and bone density is quite well known now. And yeah, so if you do struggle with menopausal symptoms, then again, you might want tailored help to support you to maintain your physical activity and get your hormone balance as best you can.
There's a question, Monica, about long COVID, and while you're just having a look at that from Hazmath, if you could just have a little look about that, about the difficulty of getting help sometimes. Are there any websites? And just Zoe, it popped back into my brain about which type of Tai Chi's build strength. So the Chen, CHEN style is the type that has got quite a lot of muscle building to it and might be too much for many people. But the Wu style is the one that actually involves quite small movements, but builds a lot of core strength and balance because it practices you going on one leg and so on and so forth. So that might be a good compromise in a way. And in fact, all of them can build stamina and muscle, but I think those two might be useful. Monica, thank you. You've popped that in the chat. Go ahead.
I have, and I'm very happy to follow up with Hazmath separately if you want to send me an email, and I can share some more thoughts. Yeah.
Great. Okay. So
and what Rob has just posted in the chat there is exactly what we heard really frequently throughout the trial. So you know, yeah, it's really sad, and this is the reason why we are wanting to do this ongoing work with the support of the Better Health and Care Hub Accelerator Grant.
And I think it's fair to say that breathlessness, unfortunately, is a very stigmatized and isolating symptom. You know, it's very difficult to say to people, oh well, I you know, we heard people saying about how, you know, they can't dance, they gradually have to withdraw from social things and so on. So a key is thinking about ways to try and reverse that, and it isn't well recognized. Exactly for the clip that I showed you, but multiple more examples of that. And it's also you know, it's a socially tricky symptom because people can't breathe, they can't talk. So, you know,
can I add another point on that?
Yeah.
Something that we did is family caregivers. If somebody in your household is breathless, it's so tempting for family caregivers to jump in and I'll do that for you because you're breathless, or to be impatient because the person with breathlessness is taking longer to do it. But every time we kind of take an activity away or make somebody feel bad that they're taking longer, we kind of reinforce that spiral of disability. And sometimes we need to look at ourselves and think, does it really need to be done that quickly? Can't I just give them some space and not draw attention to the fact that they're taking a little bit longer? They'll ask me for help. You know, if you can discuss in the family, how can I help you? When do you want me to jump in? How will I know that you want me to help you? Rather than jumping in and taking over. And I think some patients in a study I did described the family as smothering them with attention and love, when actually they just wanted to be able to get on and do things at their own pace and not be made to feel bad or slow.
I think that's such an important point, Jo. It's very, very stressful for family members to be around somebody who's breathless because you love them, you worry about it. And often one can think one is doing good by doing things for them. But actually, a bit like the picture you showed with the lady having an aide to help her do the things by sitting on the stool, and some of those walking aids, a high stool, or sometimes the walking aids that you can turn around and sit on. If you can get people over the stigma of using those things, then actually it is quite important, because then they can do more and they get more confident. And what I love about physios is that you're very good at saying to people, well, go on, then you have a go at doing it. And when we ran the breathlessness support service, we actually did a walking test, and the relatives were amazed. Because we did that test so we could see how far somebody could walk in 6 minutes between two cones, basically just going slowly and being supervised. And relatives would say, oh my goodness. And then we could see during the course of the program how much people improved, how far they could walk. And even if they could only make it once the first time, they'd come back and do it 2 or 3 times, and so on. So people could get out and start doing things that they wanted. So those things are really important, but it's very stressful for those who, if you're looking after somebody who's breathless. So be kind to yourself as well, because it is a hard thing to do. Is there any other questions? Well, pretty much on time. So Robert said something of being sedentary is the worst thing that could be doing related to breathlessness and or long COVID, from Rob. Jo, do you want to just go over that again?
Yeah, I think
just as a last point.
Yeah, I think it's just that we know that being sedentary doesn't have very good health benefits for anybody, even those of us who are working and think of ourselves as well, that being sedentary is not a good state. We're not designed to be sedentary for long periods. So not being sedentary, standing up, doing activities more frequently is good on its own, never mind physical activities and exercise. So just reducing the time spent sitting is a small step to doing something to improve your health, even if it's just to have a stand up and take a turn around the room and sit down. And again, I've patients in the past, because things are usually better if we can turn them into habits. But I've had patients who say every time a TV program ends, I stand up. I stand up just for a few moments. Then when the next program starts, I sit down again. Or when the news comes on the radio, I stand up and take a few steps. And when the news finishes, I sit down again. Just kind of building those little breaks in the day into your sitting so that you're not sitting all the time is good for your health.
Right, we're spot on time, so we should finish now. Can I especially thank Joe and Monica for their work? Can I also thank Rachel, who's been behind the scenes, making everything work and got us all together, and also Honor Morris, who's the business manager for the Better Health and Care Hub. Can I thank you very, very much for attending and joining us? We'll give you a link in the chat if you'd like to give us any feedback. We'll give you the links again. But please, if you're interested in the Better Health and Care Hub, which is a big new initiative at King's, do get in touch with us. And you can reach us on an email that we'll share with you. But can I say thank you so much for joining us. And now is the time to stand up, if you can. Thank you.